Peace, folks. This is Malachi from Creative Suitland, and should be joined shortly by Marcus and Tamisha Ponder. We are having our next installment of Wellness Chat, so we'll be featuring Marcus and Tamisha very soon. Just going to give them time to log on. See, we have a couple of people joining in already. Welcome, everyone. There we go. View request. Go live.
Hey.
It's an echo. Okay, we can't hear you, Malachi.
There we go. Can you hear me?
Yes.
Cool. There we go. Sorry, my Bluetooth speaker was on. That's why. But hey, we got a bunch of people in here. Creative Suitland. Hello, everyone. Welcome to Marcus and Tamisha Ponder for joining me for Wellness Chat. This is conversations that we've been having pretty much the whole pandemic, just trying to get people to stay healthy, stay on top of their health during, of course, this wild year that it's been, among many other things that's been happening this year. But wanted to at least hand the virtual mic over to you all, just to introduce yourselves, let the people know who you are, why are you here for Wellness Chat? Just let them know, and then we'll start from there.
So I'm Marcus and wife Tamisha, and we are the owners of Sankofa Yoga and Wellness, and now Sankofa Health.
Okay, so who we are, so a wellness space that cares truly about the holistic sides of everyone, the holistic health. We know that health is faceted, and that we just wanted to take part in being sort of like a bridge in the space to help folks understand the many sides of health and wellness, and really start to incorporate it into their regimens.
Yeah, I was going to say I'll save that question for later. Before we jump into like the actual wellness and health conversation, wanted to at least start with you guys' experience as entrepreneurs, because this is something outside of wellness that's also like the conversation that I want to have with you all is, I guess you guys been open for about a year, or a little bit more than a year, with Sankofa Yoga. I think July 1st of last year. That's right.
Yeah.
Literally a year later, you guys opened up, expanded into a new space above the first studio, which is like the workshop space. And then a couple months later, you guys opened up a Sankofa Health Center. So I'm like, that's like 3 businesses in like 1 year. And most of this was like during the pandemic. So can you just let me know just what was the experience like starting the first business, and then expanding again into a whole new business, for those that have no idea what I'm talking about.
I'll start with the first one.
Oh, go ahead.
Okay, I'll start with yoga. So I have been teaching for about 8 years or so before we opened up the studio. Yes, last year, July 1st, 2019, in Laurel. And we're teaching yoga specifically in many different styles. And a lot of teachers will tell you, especially teachers of color, Black teachers, that there are spaces that we feel less than welcome in spaces when we're teaching, right? And so, but I was so honored and so grateful to have an amazing yoga home with Spiritual Essence that I didn't have to experience much of that when I came into my yoga teaching. Now, there was some spaces where outside of Spiritual Essence that I didn't really feel so comfortable in. And so I would share that with him, as I would teach this place or teach somewhere else. And everyone would say, do Black folks do that? Like, oh, you're the teacher? Like, oh, where's the teacher? And I say, oh, that's me, right? But I hadn't had, it was one life-changing experience where I remember it was right after Trayvon Martin was not when he was killed, but it was when the case went for him and George Zimmerman, and he was acquitted. And all of that had happened. And I went into a yoga studio the next, and everyone was just flipping, dancing, and saying, oh my God, it's such a great day. And I was going through it. I was experiencing the blues, and I knew this place was not the place I needed to be, because they had no recollection or understanding of what I was feeling emotionally, spiritually. I just been crying for hours, like the whole entire day before. And I came to yoga for a release, and it just made me, even more upset. So those little instances kept happening, like little paper cuts, those microaggressions that happen in wellness industries where our mental health has not taken in consideration on how we show it physically. So I was telling him this for like many, many years. And then he's like, you know what, Tamisha, let's just open it up. Let's just go out there and open. Now, I had been operating in my home for a little bit over a year to taking some private clients, but we definitely, our first jump was in to create a space in Laurel. I'm from Laurel, that's my hometown. And we felt that it was best to create a space and pay homage to my hometown, because I knew there was nothing like that in that space, especially in Laurel. If you're familiar with Laurel, it's nothing like it in Laurel. So we opened. Laurel is super diverse. Like, I grew up in a very diverse community, but in terms of what faces were the face of wellness, it was not us, right? And so all that to say, we opened up Sankofa Yoga July 1st, 2019, and it was a joint partnership. It wasn't just I'm teaching yoga and then here's Marcus. It was both of us open up the studio. So I'll take it. I'll let you take it from there.
No, I mean, like Tamisha said, we wanted to create a space that was inclusive, that felt good. I know one of the things for me was, and Tamisha, she shared her story of like what was her turning point. For me, my turning point was, here Tamisha is been practicing yoga for all these years, and she goes inside of a studio. I forgot what studio it was. Well, I won't even mention it. As an experienced teacher, at the time she was a 200, now 500, and she goes into the space, and they thought that she was a beginner just because she was Black. And they told her to take her mat
and go to
the back of the room to take a class. And I said at that point, I was like, we have to change this narrative. This is not okay.
Yeah.
And same thing. And for the past year, we kept, getting the feedback from the community coming to us and saying how much Sankofa yoga has changed their lives. And so in the earlier part of the quarantine, and Malachi, I'm answering a question on the business side, but this is more on the side of like our call to action to the community. Was I kept sitting back probably March and April and thinking about such a large impact that we've had on the community. And I was like, but it's not enough. Like, there's more to be done. And we did so much stuff on the wellness side. And I'm getting these calls saying Sankofa yoga has changed my life. I've been battling with anxiety. I haven't moved my joints. I just got surgery. I haven't moved in all these years. And seeing what Sankofa yoga has done, I said, it's time for us to get in front of the healthcare. Because I realized that just as many disparities that we've had in wellness, those same disparities exist on both the patient side and the provider side in healthcare. From providers being treated horribly to not getting equal access or opportunity, to Black doctors being treated unfairly, to Black nurse practitioners and nurses, and then it's also the patients as well. So I said it's a call to action for us to change the narrative for healthcare in our own community. From everything from the patient side to actually listening to our patients, to talk to them, to creating an inclusive environment for them to get healed by people who look like us. Mm-hmm. And I felt it was time. And so throughout the early part of quarantine, I went to Tamisha. I said, "Listen, we have to change this. We have more to do. We have a lot more work to do." And she said, "Let's do it." And for the past 8 or 9 months, we've been really head down, just focused on figuring out ways. We know the quarantine won't last forever. We know COVID will eventually go away. But it was our opportunity to really sit in this space and figure out what more can we do to empower Black folk, to empower our community, the Black and brown community, people who look like us that come to our space and looks at our space as home, Yeah.
Yeah, I love the connection with yoga and physical health, because yoga for me, that, I guess going back to Tamisha's point with walking into a studio and then they automatically assume you're a beginner. You get pushed to the back, or you just get the looks and the stares like, what is this person doing in here? Just feeling out of place. And then having that comfort level, being in a either Black-owned space or mostly Black, community, that, you feel a little bit more welcome. You feel more open to actually practice versus being in that closed environment, because it seems closed. It seems like everyone's in their own little corner, and then you're there trying to do your own thing.
Yeah.
Same thing can be said with physical health, going to the doctor and feeling comfortable going into a doctor's office and knowing that they're going to have your best interest and they're going to educate you and that's probably why, we wanted to do these conversations, because the conversation can go a long way, just have open conversations about health, mental health, physical health, spiritual health, emotional health. I think I said spiritual health, but yeah. So I guess going into Sankofa Health Center, that's where you are now, and just tell us, what is Sankofa Health Center? What are the services, the offerings, and what makes it unique?
Yeah, so Sankofa Health Center, we are a community-focused, community health-focused health center. We have kind of two sides. And the way I've been explaining this is two sides to Sankofa Health. The first side is urgent care. So we can do everything that your standard urgent care can do, right? So you fall, you come in, we can patch you up. You need a physical, we can take care of you. We can do it all. We've been doing a lot of COVID tests lately, so we can handle all the urgent care stuff. The other side of the coin, which I'm really passionate about, something Tamisha and I were still building out, is the preventative side. Yeah. There's so many disparities in the Black community. There's so much that goes on within the Black mortality rate for Black women giving birth. With Tamisha expanding our doula and our doula offerings. We have the urgent care side, but we have the preventative side. So we're really sitting down with our patients, having conversations, designing treatment plans specifically focused to them, tailored to them. We had somebody come in earlier this week that was battling anxiety. And the first thing that I've been training all of my practitioners on is, we're not just prescribing. This is not a pill mill, right? We're not just giving more medication out that does not work, and years later they're realizing that it doesn't work. We're saying, hey, try yoga, try meditation, try therapy. These are the things. And so Sankofa Health is really an integrative practice, is what we read out. We're integrating the wellness side with traditional medicine. So that's who we are.
And I would add that from our experiences, even before opening Sankofa Health, when we are approaching health or having a conversation with folks, wellness may seem kind of far off with them, right? But health, they completely understand, right? They understand health. They understand the doctor's office. They understand the hospital. But when you start talking about like emotional health and well-being and spiritual well-being, they're like, I don't know what you're talking about. I'm going to, slide left. Now, what we've been experiencing, though, is that it's the great opportunity to meet people where they are and allow them to experience what can happen when true holistic health happens and when holistic wellness happens.
Yeah.
With my experience of, being a doula and my work in women's health and reproductive justice and reproductive health, in that space is that many folks too, is that if they are, say my pregnant clients, they are under doctor's care for the majority of the time, or they feel less comfortable moving into a sector of, okay, I could possibly have a natural birth. This is possible, right? So, some things are understanding what support looks like. We are, as a society, of course, over-medicalized and under-medicalized, depending on the community. But to have someone that not only looks like you, but understands your racial makeup, your cultural makeup, that adds on to stress, is not just medicine. It's not just it's not a fable. So when we got to talking about the Black maternal mortality rate, people think it's a myth if you're not part of the community, but not understanding how much our racialized experiences take into the stress. And so what we bring to the table in this space is that our lived experiences, our professional backgrounds, all add on to the notions of what we bring to the community. From my years of community organizing as an anti-racism trainer to a women's activist in the space, Marcus in the completely business space, like really understanding how we can make our dreams come reality and work with community. Marcus has been rooted in community since he was a child. And we hope that everyone understands when they come into our spaces, any of them, is that we are community focused, point blank, period. It is about servicing the folks who people overlook or underrepresent, and those who may not have the exact knowledge in a space because they've been socialized another way. So while we get you here for health, let's discuss wellness. Let's discuss holistic wellness as a literally at a whole being.
I'm going to ask you to define holistic wellness, but before we do that, you hit a point with me, because I guess we just have to what you're doing is breaking the mold of the traditional going to the doctor. You're saying you have anxiety, and they say, okay, here's a prescription. You take Xanax or, whatever pill, and then boom, you go to the pharmacy. They barely give you instructions. They barely give you any type of background information about the drug and the side effects, blah, blah, blah. You have to ask the information. To me, that never set well with me, because when I went to the doctor for anxiety, they gave me a prescription, and I just said, I'm going to find my own way, because I know with, I guess, just seeing movies and just seeing people go down that rabbit hole of taking a drug and then being on a pill for the rest of their life and being a zombie. I didn't want to do that. That's when I got introduced to yoga. That's when I literally walked into spiritual essence, and I was just like, yeah, I can, do without the prescription, because it can, we can do it in other ways. But going back to holistic wellness, can you define what holistic wellness means? Because some people feel like it's I don't know what the right word is, but it's not, I guess it's more not sanctioned, or it's not FDA approved, which means it's not, something that's beneficial. So can you break down holistic wellness?
Sure. Well, first and foremost, holistic wellness is the major key. Holistic wellness was here first. Holistic wellness is what the world existed on and with, and continue to multiply with through our natural, innate, ancestral understandings of wellness. So we take holistic wellness, I can break down into two words, right? So wellness is well-being. There's a difference between health, wellness, and fitness, right? Like we are not a fitness industry. Yeah. Now we do, of course, promote physical activity, of course, to release endorphins and things of that sort. But wellness is an entire state of being. It is not a one-time experience. And now I'm well, right? It is a practice. So a wellness practice can include things that range from not only your diet, but from your coping mechanisms, stress reductions, understanding your energy balances, knowing what you may carry that may be ancestral, things that we know that need to be cleared, maybe, in our chakra system. That exists in cultures around the world for centuries, way before the medicalization period. So we want to just always pay homage to what has been there before we started prescribing human tendencies and spaces, or just, colonizing health, for a better way of saying it. So holistic wellness is the natural way of being. However, it is also so many facets. So you have, if you see a holistic wellness practitioner, that is your acupuncturist, that is your massage therapist, that is your Reiki practitioner, sound healer, anyone that works in the energy field. A chiropractor is also wellness as well. So holistic wellness is from head to toe holistically. That includes mind, body, spirit. We know that you can't address, I have a pain in my shoulder. What is the root to it? So rather than addressing the cure or fixing it with a Band-Aid, we're getting to the root of the concern. And that's where holistic comes into why we are holistic wellness, or a health organization, that we focus on the holistic person, that not just, you're sick today, let's fix this today. Let's also address some of the stress factors that could be playing into why this is repetitive and it's showing up and will manifest in your body. So that's how holistic wellness. I know that was a long-winded definition, but
no, I mean, that covers, I guess, like almost the full scope of what it is. And I guess for people who have no idea what the term means, or have, preconceived ideas of, what holistic wellness is, that pretty much sums it up. So I guess
sorry, my guy, to Tamisha's point is, that's one of the things that we did when we hired our practitioner. So the first thing that I did was, I asked in every interview I did was, I said, this is who we are, right? This is the foundation of who we are. Is the wellness space, is yoga, is meditation, is therapy, and so forth. And if you cannot respect that, then, you're not a good fit here. And so I wanted to really make sure that we had practitioners, medical staff, that understood the foundation of where we come from, and that needed to be integrated in every treatment plan that we do for each patient that walks out. Every patient that walks out the door are handed our yoga flyer, right? And it's not to promote Sankofa yoga, well, kind of it is, but also it's also to let them know that there are alternative ways that they can heal their body and to move their body, heal their mind as well. They're also given some incense, right, to kind of just relax and mellow out when they get home as well. So we make sure that we are also always, every patient that walks in and out our door is understanding of our foundation and where we come from.
Yeah, that's exciting. I mean, you're planting the seed. That's all. Yeah. So you said patients, so they can make Sankofa Health Center their primary place, primary doctor, basically. They can do that.
Yes. So we've been getting a lot of requests for that. So a lot of folks have been coming in just for the urgent care side. And then the first question they ask is, can this place be my primary? I like the vibe here, you know, and of course I laugh at that. I smile because I want us to be that for folks, right? I want people to feel comfortable when they walk through the door to not only get treated for that exact thing they came in for, but also realize that they can come here all the time. And this is a community. And I let everybody know that, you know, once you've, you know, gotten the service from Sankofa, you're part of our community, you're part of our family. So yes, we for sure can be your primary as well.
And then I guess the complicated question for some people is health insurance. If they don't have health insurance, is that going to be a financial burden, or do you have like financial options or payment plans? You know, how does that work?
Yeah, so that's something that's really near and dear to me. Like Tamisha said, I'm rooted in community service. I understand, you know, how expensive healthcare is. I understand that a lot of folks, you know, they don't always have insurance, or they don't have the best insurance option through their employer. One of the things, and I'll tell a quick story, is we had someone walk through our doors last week, and he was new to this country. And a lot of folks who are new to this country, a lot of folks who are, you know, who don't really understand the immigration systems, they're afraid to come get healthcare, right? To come get treatment for anything, because they think they're going to get reported, or, you know, to the immigration or so forth or whatever. So I was proud to be able, in that moment, I was proud and realized that we're owning something here. Because not only, yes, to answer your question, yes, we do accept all major insurances, all the major commercial payers, we accept all the major insurances. We also accept Medicaid and Medicare as well. But it was something that I really wanted to make sure that we had opportunities for the uninsured as well. So access to quality healthcare. You know, there are free clinics, there are, you know, clinics who serve certain situations or whatever that are out there. But we wanted the folks who did not have insurance to have access to quality care, to a place that really cares about them and understands them. And so, yes, we accept uninsured as well at a very inexpensive rate. And we also discount our follow-ups. So you're not just paying a flat rate when you come in. You're going to pay a flat rate for that initial service, but we significantly discount it for follow-ups, for follow-up treatments as well. So,
oh, that's great. I'm hoping anyone that is watching, we have a lot of fun comments scrolling on here. I guess if anyone else have questions, anything that you want to ask our guest, you can definitely submit a question. I thought I saw something. Someone said Dr. Ponder is teaching. I guess you said something that here for this. Okay, I thought I saw a question. Never mind. You mentioned COVID testing earlier. You do have a question, but before we ask that, you did say you offer COVID testing.
I think it froze.
Oh, no. Can you see me now?
There's a delay on our in here. Hold on.
Hear me now?
Yeah, there was a delay. Okay, we're back.
Okay. I don't know how much you heard. I just said COVID testing. You offer. I think you mentioned earlier you offer COVID testing. That's right.
Yeah. So that's this week kind of kicked our butts a little bit. We do COVID testing. We've been doing a lot of COVID testing all week, mainly because, you know, Thanksgiving and travels and stuff. So yes, we definitely do COVID tests. I know folks in our area, in the Laurel area, they been waiting in line for hours. They were, you know, turned away from other facilities, and we've been able to take them all. So I'm definitely proud of that. So definitely, if you need any COVID tests, please feel free to reach out to us, make an appointment online, or just walk in.
I was going to say, can they just walk in? Are you accepting walk-ins, or how does that work?
Yeah, we're accepting walk-ins. We do prefer that you register or book online before you come, so you can we can send you out your forms, your documents. You know, we try to do paperless as much as we can. You know, save the planet. But you know, if you are unable to do that, definitely feel free to walk in, and we can take you on the spot. So.
And how you can do so. To book all of our appointments is sankofahealthcenter.com. And so that's how you can book any of the services that way. And so what you'll be sent is a prompt to submit all of your information in advance. So literally it's completely paperless if you want to do it that way. That includes sharing your card information, your insurance card information, and all of the reasons once you're there. That also cuts back on some of the time of your wait if you do it in advance.
And Malachi, I did see a question of what's the turnaround on tests. And so our turnaround right now, we're not doing rapid testing. There are some facilities that are doing rapid testing. We are not. Our turnaround time is 3 to 5 days. I've seen some 3 days, some turnaround in 5 days. It just really depends. But the average turnaround time is about that 4-day mark as well.
That's a good question. Karama Yogi says, how can this model be reproduced in other cities? So I'm assuming the model of, I guess, the health center or the holistic services, I guess that was his question.
So how can this model be replicated in other cities? It is, right? I haven't really seen too many, healthcare and yoga kind of mixes, but we're seeing a lot of dope yoga studios in other cities. And I definitely don't want to underscore those. I'm in Philly a lot. There's so many amazing spaces in Philly, Atlanta, where we have a lot of friends in Atlanta down there. So this is definitely happening in other cities. We're hoping that, we can continue to connect. Also, conversations like this is how we spread the messaging, spread the message, and hopefully, there are other spaces that are listening in, and about how we can continue to, spread this message. I think this is something that's super important. Tamisha and I, we're super big on community and also giving back as well. Everything we do is service driven. There's not a single day or single idea that we come up with that is not service driven, and we really believe in that. When I first created the idea of Sankofa Health, when God planted this idea on my heart to do, I prayed about this for a long time, right? This is not something that just kind of popped up. I really prayed about this and met with a lot of people. And I didn't look at a single forecast. I'm a finance guy, I'm by trade, MBA. I didn't look at a single forecast, projection, or any of that of how much money we could have possibly made, because my number one thing was I wanted to do something additional for our community. I wanted to expand our offerings to give back. So
especially in the season of the pandemic.
Yeah.
Like at that moment, we were watching all of the Black and brown communities hit harder than any other community because of lack of healthcare or access to healthcare. Mm-hmm. That there was no other call to action that would have been as strong in our ears as to we have to do something about this.
Yeah. Yes.
And it seems like basically the perfect time.
I think it may be frozen.
Oh, am I back? Am I good? Oh no. I guess it froze again. No, you guys are frozen. I think it's coming back. Can you see me? No? Let me see. It says frozen. Are we back? You guys are moving again. Oh, don't hear me? No?
Maybe we should wait. I hear something.
Oh, there you go. Oh. Can you hear us?
I hear you.
Malachi,
it's frozen.
You've been frozen for like 5 minutes. So the last thing what was the last thing that we heard?
So,
do we want to, should I log out and start over again or so? Can you?
Yeah, let's log out and come back in.